Hello everyone. In this session, we are going to discuss three special terminologies in neoplasia, that is teratoma, hamartoma and choreostoma. You usually get short question or very short question on these three terminologies in your university exams. So let's start it. So here I will be discussing three things: teratoma, hamartoma, choreostoma. So first we will see everything about the teratoma, followed by we will see the hamartoma and choreostoma, which are not actual neoplasm. So let's start with teratoma. Now in human body we have multiple organs. All the organs during embryonic stage, they are derived from one of the three germ cell layer. So there are three germ cell layers are there, that is ectoderm, mesoderm and endoderm, and each organ is derived from one of the germ cell layer. So if any tumor occurs in any particular organ, that tumor is derived from one germ cell, not from all three. So either the tumor derived from ectoderm or mesoderm or endoderm, one of them. So most of the tumors, maximum tumors in human body, they derive from one germ cell from which that particular organ is formed from the embryonic life, in embryonic life. But what are teratomas? The teratomas are the tumors which arise from totipotent cell. What are totipotent cells? The totipotent cells are the cells, these are the cells which can differentiate into any of the three germ cells. It can differentiate into ectoderm, it can differentiate into mesoderm, and they can differentiate into endoderm also. So basically, teratoma is a tumor. It is a type of germ cell tumor. It is composed of multiple derivatives of the three germ cell. So it contains, sometimes it can contain all three germ cells. It can contain the derivatives of the ectoderm, it can contain the derivatives of mesoderm as well as derivatives of endoderm. So it is a unique tumor. It's a type of germ cell tumor in which the components is derived from multiple germ cells, maybe all three germ cells sometimes. So that is teratoma, unique tumor. So it can contain multiple components, like sometimes it can contain the teeth, hair, bones, muscle inside the tumor. It usually occurs in the gonads. In males, it can occur in the testes, and in the females, it can occur in the ovaries. Now you can see this is the gonad, the testes or the ovaries, inside which you can see the teratoma. Now the cut surface, you can see the teeth is present, you can see the hairs are present, sometimes the bone is present, you can see all these components. Usually it is benign, but sometimes it can be malignant. So that is teratoma. It is a tumor which is derived from the totipotent cell. So it can differentiate into the components of any of the three germ cell layer. That is a unique thing about the teratoma. Now coming on two different terminologies, that is choreostoma and hamartoma. Both of them are not actual tumors. They are not tumors. They are not actual tumors. Now looking at the suffix oma, choreostoma, hamartoma, you may feel like they are the tumors, they are the benign tumors. No, they are not at all tumors. So these are the lesions with tumor-like names, but these are not tumors. So what is choreostoma? What is choreostoma? Choreostoma is a normal tissue at abnormal site. And what is hamartoma? Hamartoma is abnormal tissue at normal site. You will say, ma'am, what does it mean? Normal tissue at abnormal site, abnormal tissue at normal site. So it's a little bit confusing. We will see the details. Wait. So let's start with hamartoma. Let's start with hamartoma. What is hamartoma? In hamartoma, the site is absolutely normal. The site is absolutely native or indigenous. So site is normal, but only thing, tissue become abnormal. What is abnormality in the tissue? Tissue become focally maldeveloped. This is focally malformed. I mean, it is not dysplastic, it is not anaplastic. For example, let's take the example of lung. You know, inside the lung, in the respiratory tract, the cartilages are common. Do you know that? Of course, we have cartilage in the lung. So you can see this is a cartilage which is present in the lung only. So you will say, ma'am, site is normal. The site is indigenous. The site is native. Cartilage is usually present in the lung. It's normal. The only thing, it become malformed. Here the cartilage become malformed. It is not dysplastic. It is not anaplastic. It's not cancer. The only thing, it become malformed. So it is the hamartoma of the lung. In the same way, do you know inside the spleen, we have two pulp, red pulp and white pulp. Both the pulps are normally present in the spleen. So here inside the spleen, you can see red pulp is there. So of course, it's normal site. Site is indigenous, site is native, site is normal. The only thing, the red pulp become malformed. The red pulp of the spleen become malformed. So basically the tissue is malformed, but its site, it is normal only. Whatever it should be, it is that only. So that is hamartoma. Now coming on the next terminology, that is choreostoma. What is choreostoma? What is choreostoma? Choreostoma, here the site is abnormal, but the tissue is absolutely normal. Now have a look on the tongue. Can you see this is tongue? On the tongue, what is this? Oh my God, what is this on the tongue? On the tongue, we can see osteocartilage. Osteocartilage is present. Let me show you. You can see this is the osteocartilage. It's present on the tongue. So on the tongue, we don't have osteo. Now, if you cut it, it's absolutely normal. It's not malformed. It's not dysplastic. It's not anaplastic. So tissue is absolutely normal. But the only thing, its site become abnormal. Normally on the tongue, we don't have any osteocartilaginous component. But here the site is abnormal. The site is ectopic actually. So that is known as choriostoma. Similarly, you can see we are doing the endoscopy here of the stomach. We are doing the endoscopy, and inside the stomach, we found something and we cut it and we see it's absolutely normal pancreas. Absolutely normal. Not malformed, not disformed, no dysplasia, no anaplasia, nothing. But inside stomach, we don't have pancreas normally, right? So here the tissue is absolutely normal. The only thing is side become abnormal. Inside the stomach, there is pancreas. So that is choriostoma. So I hope you got it. What does it mean? So what is hamartoma and what is choriostoma? What is hamartoma? What is choriostoma? In hamartoma, what is normal and what is abnormal? Learn abnormal. What is abnormal? What is normal? What is abnormal? In choriostoma, also learn what is normal and what is abnormal. So basically, don't try to learn both. If you try to learn both, you will get confused. So how to learn? In hamartoma, the tissue is abnormal. Basically, it is malformed, but it is present at the normal site, the indigenous site, the native site. But in choriostoma, the site is abnormal. It's ectopic, but tissue is absolutely normal here. The tissue is absolutely normal, not malformed. So learn what is abnormal. So how to learn what is abnormal? So in hamartoma, the tissue is abnormal. So obviously site is normal. And in choriostoma, the site is abnormal. It's ectopic. Obviously tissue is abnormal. Tissue is normal. So learn what is the abnormality. Obviously the other thing is normal only. This is how I learn. Okay. So I never get confused. Hamartoma, abnormal tissue. Choriostoma, abnormal site. Learn the summary. So we have seen the three special terminologies on. Usually you will get the short questions in your exam. Teratoma is a unique tumor which is derived from totipotent cell. So it can differentiate into ectoderm, mesoderm, endoderm. So it can contain various components inside the tumor. So inside the testes or the ovaries, whenever teratoma is there, the person can have teeth inside the tumor. Yes, teeth, hair, muscle, brain inside the tumor. So technically anything can be present inside this tumor. Usually it's benign, but sometimes it can be malignant. What is hamartoma and choriostoma? In hamartoma, the tissue is abnormal. So site is normal. In choriostoma, the site is abnormal, but the tissue is normal. And you can understand both of them with examples. I hope you got it. So don't forget to have a look on long question, short question, very short question, and MCQs from this topic, which are given in the notes section and question bank section of the app. So thank you so much.